Hello, I am Dr. Sahib Goda Shetty, consultant plastic surgeon at Dr. Shetty's Cosmetic Center, Rajajinagar, Bangalore. Lipomas can be solitary or multiple. Solitary lipoma can be big also. Sometimes it can be 10-15 centimeters. In those cases, earlier we used to cut the whole diameter of the lipoma or almost the diameter of the lipoma to remove the lipoma. That used to leave a big scar. Now with the help of liposuction, some 5 millimeter scar, we can remove the whole of the lipoma. The fibrous tissue, whatever is left, we make a small cut, same of size of like 7 millimeter or so, in the summit of the lipoma and remove all the fibers so that there is no scar or almost nil scar. Instead of like having one big 15 centimeter scar, we can just give 5 and 7 millimeter scar, two scars which are almost invisible. Whatever little remnant, that also can be reduced with the help of lasers. In case of multiple lipomas, so earlier the treatment used to be worse than the disease. Each lipoma used to have a scar. Multiple scars on the hand or abdomen or thighs used to look bad. Now, with the help of liposuctions, the lipomas are dissolved, like they are reduced in size through a small cut. Suppose if there are like 50, 60, 100 lipomas in one hand, through tiny incisions which are not visible, from there we can enter each of the lipomas. So in one hand, that is one upper limb, that is arm and forearm, we have only two tiny incisions. Through that, the small tube is inserted, steel tube. Before that, probe is inserted to emulsify the fat, to decrease the size of the fat. So then liposuction probe is inserted and the lipoma is sucked. And then fibrous tissue, which is called as network or mattress, that can be removed through the same cannula. Ultimately, at the end, we'll have a small probe mark, which is in the invisible area, hidden area, and that it is very small. So remaining scar also can be reduced with the help of lasers, depending upon the nature of the scar.